everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Entacapone. Its brand name is Comtan. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Entacapone is a selective and reversible inhibitor of catechol-O-methyltransferase, or COMT, C-O-M-T. COMT is responsible for catalyzing levodopa. Its goal is to result in more dopaminergic stimulation in the brain and lessening of the symptoms of Parkinson's disease. In terms of indications for use, Entacapone is indicated to be used in the treatment of Parkinson's disease as an adjunct therapy. Now, before somebody was to use Entacapone, there is one contraindication that they must clear, which in this case would just be a hypersensitivity to Entacapone or any other component of the product, and there's also some precautions and warnings that patients should be made aware of. Orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, may occur, as well as syncope. Use of non-selective monoamine oxidase inhibitors with Entacapone should generally be avoided. There may be an increased risk in developing melanoma with the use of this medication, so monitoring would be recommended. It should be noted that diarrhea and colitis have both occurred. The medication may have to be stopped and therapy should be given if a patient is experiencing prolonged diarrhea. Caution should be used in patients who have biliary obstruction as well as hepatic impairment. Patients should be made aware that severe rhabdomyolysis has been reported. Some patients find themselves falling asleep during normal activities of daily living. This could occur with or without accompanying somnolence. Abrupt discontinuation or dose reduction may result in a symptom complex that's similar to neuroleptic malignant syndrome. New onset or worsening of dyskinesias may occur. Some patients may notice the appearance of compulsive behaviors or impaired impulse control. And finally, for precautions and warnings, this medication should be avoided in patients who have severe psychotic disorders. Once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Entacapone, they can expect to receive their dose orally. So if somebody is using Entacapone to treat Parkinson's disease as an adjunct therapy, they would typically use 200 milligrams orally with each dose of levodopa carbidopa. The maximum dose would be 1600 milligrams per day. Some patients may have to decrease their levodopa dose or increase the interval between levodopa doses to optimize their therapy. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Entacapone, so I'll go over some of those here now. Abdominal pain comes in at 8%, while 10% may experience diarrhea, 14% may experience nausea, and 4% may experience vomiting. Backache may appear in 2 to 4% of patients. 25% of patients may experience dyskinesias, and 10% may experience hyperactive behaviors. Discolored urine may appear in about 10% of patients, and fatigue comes in at around 6%. The more serious side effects would be syncope, which comes in at about 1%, rhabdomyolysis, neuroleptic malignant syndrome, and finally hallucinations. That's all we're going to talk about today with Entacapone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.